The views and opinions expressed on this platform are of me, myself, and I, not any agency I'm affiliated with. So please do not take what I say personally. Just want to throw this in before you begin to listen. Jacob and I recorded in a coffee shop, which I thought was going to be a really cool little setup, but the audio got a little funky. I've tried to fix it the best that I could. Also, at the end, I've included the interview that Jacob did for me, which really appreciate that. But anyways, in case you're wondering, try to fix the audio. Bear with me. Thank you. Coming live from a coffee shop in Lafayette, Louisiana. I have with me today Jacob Davis, really cool guy. We actually found out after we had worked shift together, we went to the same church camp years and years and years ago. So we go way back, I guess you could say. Smart guy. I'm super impressed with him. Jacob, you're actually doing flight, like you're studying flight school, right?
Yes, that's correct.
I don't know what the actual term for that is, or the phraseology.
I don't think I'd call it flight school, but it's for the FPC. It's the critical care certification for flight.
See, that's how far removed I am from it. But literally walked in and he was studying for that. I was like, okay, cool. Another thing to tack on. I wish I could be Jacob when I grew up. So something like it. I appreciate him, appreciate his friendship. And Jacob, if you want to go ahead, give a little intro about yourself, tell the people who you are, what you stand for.
Sure. Yeah, my name's Jacob. I started in EMS about 3 years ago, almost exactly. I got into this actually from a different side of the medical field. I was planning to be a physical therapist, so coming out of high school, I played sports my whole life. And I knew I wanted to stay, kind of connected to sports and everything. And so every high school kid, for the most part, if they're playing sports, once they get out, if they're not going to like the collegiate level to play, they're like, oh, I'll do therapy, because they can still be connected to the teams and with the players and everything. And so that was my goal. So I knew exactly where I wanted to go. I decided to go to Lafayette, or UL in Lafayette. And I ended up graduating in 4 years with my bachelor's in kinesiology. And so I started applying for graduate school, and I worked for multiple different physical therapy clinics while I was in college. I enjoyed all of it. Like, I thought it was super fun. I developed some great relationships with the therapist and the actual patients that we treated. Very, very chill environment. My problem is when I was trying to apply for the graduate schools, my GPA just wasn't good enough. So when I was a sophomore in college, I just kind of messed around and I didn't study like I should have. And so I let some things in my life kind of get in the way of my study habits and all of that. And so that hindered me greatly. My GPA was much too low to really recover from. And it was really only that year. My freshman year was fine. My junior year, senior year was fine. I actually finally figured out how to study my junior and senior year of college, which was great. And so, I gave it the best shot I could have anyways. After I graduated, like I said, I'd applied for some schools. They gave me some great feedback, and they're like, hey, just go retake some of the classes and just see if that'll increase your GPA, and then we'll kind of reconnect after. So about a year and a half after I graduated, I continued to retake quite a few of my classes. It was mainly like biology, some chemistries, and some physics. And I got my grades better. I got the A's in the classes that I needed to. And the problem is when I applied, they averaged the grades instead of replacing the grades. And so, so that didn't really help me too much. So I felt like I kind of just threw away a bunch of money. Again, I kept in touch with all the schools that I'd applied to, and they're like, hey, why don't you just take a master's degree or receive a master's degree, and then we'll reconnect again and see. And at that point, I just knew, like, I'm just wasting time because I wanted to work. I knew I wanted to be in the medical field, and I just didn't think it was worth it to continue to spend that money and then just take a chance that I might get into grad school for physical therapy. And I also kind of changed my mind and considered occupational therapy, but I was just like, I don't know if it's worth it to do that. So I talked to a neighbor of mine who was a flight medic and he told me what he did. And so up until this point in my life, I was let's see, I was 22, and I did not know what paramedics and EMTs actually did. I just knew they drove the ambulance, and so
Not the ambulance drivers.
literally, yeah, literally, like that was it. I didn't know that they gave medications. I didn't know anything about them starting IVs or any of that. Like the movies I'd watched did not show any of that. They showed them walking up to the scene, grabbing a patient, and throwing them on the stretcher, and they're bleeding all over the place. And then you don't see anything else besides them bringing them into the ER and giving a report. That's it. I was very just unsure of what they did, and so he had kind of explained, to me what the qualifications are and what your job entails, and I was like, man, I want to do that. And so, like I said, he was in the air, and he's like, you can't just go straight to becoming a flight medic. There is a process. And so he kind of sat me down, and we talked about it and what the requirements were and what I had to complete before I could do that. And I was like, that's what I want to do. So within the next month, I'd applied for EMT school. I think it was only a 2.5 month or 3 month program. And so as soon as I finished that, I went straight into paramedic school, and I was continuing to work as an EMT, while I was in paramedic school. And so that was kind of the long introduction of, who I am, I guess.
Okay, but it's really cool that you went kind of flip flop from what most people do. They'll get into EMS and then they'll take the next step of like PA or like med school, whatever. But you said, okay, let's go from physical therapy to EMS. So super cool.
Yeah, large jump.
A little bit of a 180, but mad respect. So knowing like you could potentially have a plan B of if you wanted to go get your master's, if you want to, whatever it is that you decide to do, if you didn't want to be a flight medic and be, hardcore, everybody wants to be you, flight suits, whatever.
Super medic.
Paragot. No, I'm just kidding. So what would you say is the thing that keeps you going in EMS instead of like one day just being like, maybe not? What kind of helps prevent burnout for you? And I'm gonna ask also in your regard of like balancing work and personal life, because I know y'all do this super cool family vacation every year that like I personally I'm way too, I guess, type A, because that there was that one year you like I was asking you about it and you were like, yeah, we literally just load up and we don't plan anything and we go, and I'm like, oh, that stresses me out.
Yeah, definitely. So I think that the main thing that keeps me from getting stressed out is it's very broad. Like I genuinely just enjoy this job a ton. Between all the silly calls that we get and the upset or emergency departments that we go to, it's all fun. I don't take myself super serious on this job. I mean, I take what I do serious, but I don't take myself personally too serious. So I really, really enjoy what we get to do. I enjoy the whole aspect of the job and the requirements that we have. I mean, because we do have an important job, and I think we do get romanticized to be maybe more than what we are as a whole a lot of times. But then there is those simple moments those specific moments that you have where you really are important, and you're the key factor into really helping somebody in a very poor situation. In EMS, you meet probably some of the weirdest people and some of the coolest people at the same time, which I love that. I love the fact that it's such a broad spectrum of people that you meet here. I find that EMS workers definitely adapt and they overcome to their situation because we have a limited amount of tools that we actually get to work with. And so you never can predict the challenges that you're going to have. I mean, they put us through so many different scenarios in school, and then the extra trainings that you do after school, but you can never get exactly what's going to happen, for you to be able to practice that. And so I did read, I don't even know where I read it before, but it says you cannot create competence in a stressful situation. So basically, I guess what that means is that you have to train prior. And so once you get in that stressful situation, the competency will only be there if you train prior to that, so you can fall back on your training instead of trying to figure it out in that moment. So with all the stress that we go through, I mean, people kind of let it out in different ways. One of the best ways that I've found to decompress and de-stress has been the vacations that we have every year. Me and my wife's family, we take a vacation during Thanksgiving every year. And last year was the one that she's referring to, where we just loaded up in a 40-foot diesel pusher, and we just drove. There was no like specific destination. We knew we wanted to go to New Mexico and to the Grand Canyon, I guess. So if you want to give it a destination, the Grand Canyon was it. But we had so many small stops on the way there and on the way back, and I think it ended up being a 10-day trip. And it was great. With us not really having an itinerary, it's like there's not any crazy stress because we don't have a significant or a specific timeline that you have to go through. And it's like we can just kind of do whatever. So that was probably the best part about it because that's what vacation should be. It shouldn't be like you can plan everything out, but it shouldn't be so stressed to where you have to do every single thing that's on that list. And so that was one thing that I really enjoyed about it, you know. And I mean, we're kind of close quarters, so you'd think like that would get kind of old after a while, right? But it's really not that bad. Like I said, it's just kind of carefree, and we just did literally whatever we want. If we saw a restaurant that we wanted to stop at, then we would stop and eat at it, you know. And we probably ate way more than we should have on a trip. But we got to see a lot of really, really cool places, and we met a ton of really nice people on that trip.
Also want to give a shout out to your wife. She's also an ER nurse, and she's the baddest and she's the coolest.
She is. So she's also she just changed to ICU. So she was actually on med surg, but she went to ICU probably about 2 or 3 months ago. She got off on her own, and so she loves it, everything about it, and she's great. Like with me taking the or studying for the FPC. There's a lot of things that I'm learning that, you know, I didn't have a clue about before. And so I can ask her questions about her treatments that they do in the ICU. And we can kind of bounce back and forth about different ideas. And that's been really neat, you know, to do that.
Okay, power couple.
Yeah.
Okay, getting to the nitty gritty of the questions. What is your favorite type of call? Because like I say in every episode, you got so many. You got your medicals, you got your codes, you got your psychs, lift assists, refusals.
Oh yeah, lift assists are the best. Yeah, definitely. So, you know, when I first started, I really liked the allergic reaction calls, which I know that you're extremely familiar with personally. So
That's hurtful.
one of my favorite calls that I ever had, and it wasn't like super crazy. It wasn't an allergic reaction, but I was doing a ride time or a clinical while I was in paramedic school. And we had responded to a plant that was just outside of the city limits. And so I don't remember what type of plant that it actually was, but one of the workers had gotten a chemical that was a powder, and it had blown onto his clothes. And they didn't know exactly where it came from because they have like these rail cars that are driving by, and they've got a bunch of chemicals in the actual bins that they're driving. And so it blew out, and it got on him, and he just started itching a little bit, and he didn't think anything of it. Also, within a matter of probably like 30 minutes, he started getting a rash on both of his arms, right? And so it created like the actual lesions that he was having on him, the raised bumps and everything, and then it spread from both of his hands all the way up his arms to his shoulders, and it also went onto, I think it was the right side of his face and his forehead. So he was morphing into something else at that point, along with him saying that he was going blind. So it sounded like a little bit of anxiety, right? That played into that. But he started feeling short of breath. So all of this happening was just making his anxiety much worse. And we probably had about probably about a 10-minute response. And so by the time we had gotten there, they kind of caught it pretty quick, and they did the smart thing. They took his clothes off and got the powder and everything off him. They dusted him off, right? And so they had given him some medication. I do not remember what it was. It wasn't Benadryl, but they had given him something. I think it was one of like his daily medications for anxiety, if I remember right, which did help calm him down. And so he had kind of finally gotten his breathing under control. When I'd gotten there, he was not wheezing or anything. I think the breathing was not from the allergic reaction, but because he was so anxious about the hives that he was having, and the itching, and then the blindness that he was saying, I think was possibly also from the anxiety. But the cool thing was like he was my first true allergic reaction that I got to see. So I'm doing my assessment, and I get him into the truck, and I start my IV. And so, you know, my preceptor's asking me what I want to give. So I was like, let's go ahead and give him a round of epi. Back up. I did the epi outside of the truck when I first got to him. And so it was already kind of working. So I did that IM into his shoulder. I remember that. And we got him into the truck. That's when I started the IV. And then I gave him some Benadryl. And what was really cool was like we had already kind of taken off. The scene time was probably like 8 minutes. It was very, very short. And or relatively. And so we're headed to the closest hospital. I would say within 2 or 3 minutes of giving the Benadryl, I could visibly see the hives like just go away, which I thought was super cool because it's like I felt like a magician, you know, like you're a wizard, Jacob. Like I'm on scene giving this guy medication, and like you can visibly see it change him. And to me, that like blew me away. I'm like, that's why I like doing this. Not because I want to pump people with medications, but you can see that you actually help people.
Right.
And so I love that. Like that was super cool. So for the longest time, allergic reactions were my thing. I quickly have changed to where I really like respiratory calls. Respiratory is very, very fun. It's another one where you can actually see that you're helping somebody. I think it's cool, but there's a lot that can go into that, from just a simple nasal cannula to intubating and throwing somebody on a vent. And I've been getting to do the vent transfers and stuff a lot lately.
Oh, nice.
And so it's just a whole new ball game that I am barely even scratching the surface on. And there's so much that I don't know. And so it's really piqued my interest. And probably my second favorite right now is abdominal pains. I enjoy abdominal pains.
Seriously?
Abdominal pains in the female population is very interesting because there's so many different things it can, it can be just because of how you are made up. But just in general, like abdominal pains are just super, super cool because we can't see what's going on. So like the things that you do or the treatments you perform are extremely dependent on how good your assessment is. And so, and getting a great history from the patient and trying to figure out what medications they're on and, what they've eaten, et cetera, et cetera. And so that to me is why I like them so much because you need to have a well-rounded assessment to be able to help them appropriately. And so, so abdominal pains are my new thing right now.
I have to disagree on both of them. One, because allergic reactions give me like PTSD.
Oh, yeah, true.
Two, I hate abdominal pain. Like, I get what you're saying and I agree. Do you give Benadryl for abdominal pain? Which I'm not saying you can't give narcotics to abdominal pain. I'm not saying don't treat your patient, but I personally do. What are your thoughts?
Sure. So I do think it depends on the patient. Now, personally, I don't give Benadryl to abdominal pains, even with it having the antiemetic properties, and I know it has that, but we have Zofran for that. I'm not sure if you guys carry it on your truck or not.
We do.
Okay, so I personally just choose the Zofran over the Benadryl because I don't necessarily want my patient to become sleepy or drowsy, even though you could argue that maybe you could give a half dose and it still have the antiemetic properties and it may not make them as drowsy, and that's fine. I mean, to me, it's the clinician's, discretion.
Yeah.
I prefer just to do the Zofran. As far as like the negative side effects of Zofran, we don't give enough Zofran unless somebody's hypersensitive to it for it really to affect them.
Facts.
I do find that if they've started vomiting already, that the Zofran's not as effective as like Compazine or something of the sort that they would give in the ER. But seeing as I don't have that, I give what I have.
Well, we have Finagrin, so...
Okay, so, and that's another one I would consider, As far as treating abdominal pain, if they don't have a history of bleeding, and I don't suspect that they have a bleed, we have Toradol. So, and I've gotten so many different opinions on this, and people have their own ideas about it, whatever. I've had doctors tell me that it was the right choice to give it, and I've had ER directors tell me that I shouldn't be giving it, so whatever. Again, it's up to your discretion. It's not like, for one, if it's going to promote bleeding in that patient, 9 times out of 10, they're not going to take them into emergency surgery as soon as you bring them in. They're going to wait hours. The surgeon's not going to be right there to do it unless it's truly like a traumatic bleed, like a AAA or something like that, which you would have indications of not giving, Toradol or something. And again, I don't know everything. That's just kind of my 2 cents on it. I will treat the abdominal pain as appropriately as I know to. I try not to give them narcotics if I don't have to, but if I feel like it's necessary, I will. But our first line in our protocol to treat pain, regardless of what it is going to be Toradol for the most part. And then we would step up to fentanyl, and then we have ketamine as well. Typically, I'm going to lead toward Toradol, and I've also found that when I do give the Toradol, since it's an anti-inflammatory, it helps more than any of the other drugs, whether it's morphine, whether it's fentanyl, I can't say it helps better than ketamine, but morphine or fentanyl, I find that Toradol works better for, those inflammatory type situations. So
I forgot y'all carry Tort. We used to. Y'all do carry Toradol. I miss Toradol. Not me copying and pasting this to our medical director.
Right.
No, I agree with that. I was also kind of wondering because it wasn't until, and I feel terrible saying this, like as a paramedic, It wasn't until a couple of months ago that I heard this thing about like providers don't give pain medications to like abdominal pain and stuff like that. Oh, because of their drug seeking, or like it's going to mask the patient assessment, whatever.
Sure.
But like I heard someone say, just because you bring in a patient and you gave them some fentanyl or whatever for their abdominal pain, in y'all's case, Toradol, is the doctor not still going to do his myriad of tests?
Sure, and they're gonna do all the tests that they can. And honestly, if you're in enough pain to where you're presenting where we feel like we need to give you the narcotics or whatever to help your pain, they're not gonna forget that within the 5 or 10 minutes that they've been transported. So they know where the pain was at. They know what it feels like. And a lot of times, I'm not giving them pain medicine so I can snow them, and put them asleep. I just want to give them enough to hopefully knock that pain down some. So yeah, I do disagree with or holding off with giving them medications unless you have like a 2 minute transport. Is it worth
Exactly.
taking the extra, whatever, couple minutes to try and draw it up, and then you're already in the ER bay, and then you're just deciding to sit in your truck to give them medicine versus pulling them out to get them in the ER? Like, it's efficiency is the main thing for me. I mean, yes, I'm going to take care of my patient, but I don't want to delay definitive care, and that's the main thing that I think about for that. Again, I'm constantly learning new things, and I feel like each new thing that I learn, I realize how ignorant I was before. So, some of the opinions that I have right now could definitely change next week. Like, each new section I go through with this FPC that I'm studying for, it's like, man, I was so ignorant prior to this, and I'm still ignorant now that I know the new things, because it's just so much information that that's out there that I don't know a lot about. And so, I'm trying to do my due diligence to try and learn it, so I can help my patients, because like I am passionate about helping them and giving them the best chance that they can as far as having great care performed to them. But again, that goes back to why I love this field. Like, you literally can never know it all. And if you do feel like you know it all, you probably need to get off the truck or get out of whatever treatment aspect that you're in, because medicine changes so often. I mean, every 10 years you're going to have new studies that are out that are saying that the cardiac medications we used to give are outdated, and you have all these side effects that are long-standing compared to the new ones that we have. And then 10 years later, they may go back to the medications that were used 20 years ago, because they're like, well, actually, they may not be as bad as what we thought, So it's a lot of, I guess, contradiction. But at the same time, it's just we have time to actually put those tests out there. So we are allowed to actually learn new things about the things that we already had. And so anyway, it's a really cool field.
Well, you took the words from me, because I was going to go down the route of like, oh, well, when you stop learning, like that's when you get stagnant. And
Yeah,
but
complacency for sure.
definitely took that from me, so thank you. No, solid points. What would you say is the craziest or funniest call you've ever had?
Okay, so I thought about this quite a bit, and disclaimer, I didn't think about changing the names of the people when I was thinking about telling the story, so I'm going to do my best here. We might have to bleep them out when I'm telling the story. So, anyway, we got dispatched. Probably, I think this was about a year ago or so. Me and my partner, we were working in this extremely rural little town to a seizure patient. And so I think the gentleman he's probably about 55, something like that. And so they said that he's had 2 seizures, right? The family had called it in. And so once we get to the house, he's up talking. Like, he's not disoriented, but, well, say he's disoriented, but he's not like sitting on the ground. Like, they said when they found him, he was on the floor convulsing, and he was foaming from the mouth, and so he wasn't in a post-ictal state anyway. It didn't appear. So I started asking him questions, and he can say yes or no, but like he won't like directly look at me, and he's just not making a lot of sense. Like, when I ask him a question, he'll just keep saying, huh, like he's not hearing me. And then he's also sweeping his house. So,
Wait.
yeah, exactly. So, not something you would expect from a patient who just had a seizure or multiple seizures. So we did find out from the family that he is an avid drug user. The patient loves cocaine, so he has a lot of cocaine-induced seizures. And so we don't know how much he took, but just to paint you a picture, his house is very much so got holes all in it on the outside. on the inside. Like, it's not put together very well. So he just lives in a very bad situation, I would say. And so he's sweeping this house that is dirty from like floor to ceiling. Like, the sweeping's not doing anything at all. And he kind of is resisting me. Like, when I'm trying to talk to him, like, he doesn't really want to answer me at one point. And the family's going in and out of the house. Like, they are being somewhat helpful to giving us a history. Like, they're telling me he's got high blood pressure, he's diabetic. But his main thing is that he's just a drug user and he's non-compliant with any medications. Like, he doesn't even have any of his medicine in his house because he doesn't take them. So,
Wait, so he doesn't take his actual medications, but he'll take the cocaine.
for sure.
Got it.
I mean, if you want to call that a street medicine, then yes, he's taking that. So, so again, he's sweeping. I'm asking him questions, and I'm trying my best to like coax him to coming outside, so at least we can check his vital signs, whatever. And so he's like, no, and he kept like throwing his arm away. Like, I was kind of softly grabbing his arm, like, come on, man, let's go outside and just, I just want to check you out real quick, make sure everything's fine. No, don't stop touching me. And I was like, okay. So, I don't want him to get super aggressive and just freak out on us. And so, my partner's kind of new at that point. He's only been at EMT for maybe like 6 or 7 months. And so he's just kind of like real quiet in the back. He's like, Jacob, what do I do? I'm like, it's fine. We'll figure it out. Like, just kind of hang tight. So, he finally puts the broom down, and I thought I was getting him to go outside, right? Like, he's walking towards the door, and I'm like, yes, finally, we're getting him out. But then he turns around, and he grabs a cap, puts a cap on, and he grabs a broom again, starts sweeping. I was like, man, come on. So this goes on for probably like 10 minutes. There's no police that are coming. There's no fire department that got dispatched to this. But again, the situation given, we didn't think we would necessarily need it, right?
Fair, yeah.
And so, and he's been, not, I wouldn't really say compliant, but not aggressive. It's just only when I try and, get him to go outside, he gets resistant. Well, so we step outside real quick, and I was like, listen, I tried to go grab a family member, because at that point, all the family had walked out of the house. And I said, hey, could y'all help us, bring him inside? They're like, oh, yeah, we'll get him to come in. Well, the family's a little more aggressive than I am. So they walk inside the house, and they start cussing at him. Like, you're going to get outside and get in an ambulance, or it ain't going to be good, basically, for lack of a better word. So I'm going to leave the expletives out, but then, he doesn't like that. So one thing goes to another, and they're hollering back and forth. Well, he reaches into, like, a room. There's no door on the in the room, like at the threshold. So he just reaches into an open room and pulls out a rusty pink pogo stick, and he starts beating his family member with the pogo stick. And this is terrible that we're laughing at this, by the way, but it's not like he's just beating the tar out of them or anything. Like, he's hitting them, and they're like blocking it, right?
Oh my God.
Well, they grab the pogo stick, because he's still a little like unsteady with his gait. They grab the pogo stick and throw him on the couch, and they're like, this doesn't turn into like an emergency situation for him anymore. It's like more for the family and then us, because we don't know what's about to happen. I don't know if there's weapons in there besides the pogo stick or what. So they take the pogo stick from him, right? They throw it on the ground. Well, he grabs the broom and starts hitting him with the broom, and the broom has a metal handle, and he broke it in half. So at that point, it's kind of sharp, right? Well, so thankfully nobody got hurt, but they take that from him, and then it turns into a brawl, because this was like his younger cousin, who's a female, but she's like very much so a gangster, and so like she ain't playing with any of that. So she's punching him, and he's punching her, right? And so me and my partner are sitting on the front porch, because I'm like, not a good idea for us to go inside.
No.
But I'd already called for police at this point, so I think police were kind of tied up, but they're on their way. And so when we couldn't get fire department to come to this call, they were tied up somewhere else, because I'd called for them as well at the same time.
Oh my God.
Yeah, so we're just sitting on this raggedy front porch, and the rest of the family decides to go inside. So we got like another cousin who runs in, and then like a sister of the guy who was seizing come in, and she had a 1-year-old baby on her hip, and everybody, including the babies, throwing punches at this man. And so my partner has like an idea that he wants to run in and save the baby. I was like, not gonna happen. Don't do that. Like,
I think the family's got this under
yeah,
control.
I was like, I don't want the baby to get hurt, but you will definitely get shanked if you run in there. So just leave it. Well, so after he probably gets tagged by about 50 punches, he squeezes his way between all of them. Like, I don't remember if he like crawled through their legs or what, but he somehow got out of the dog pile. And he comes running past us out the house, just kicks the door open, and we're watching it all through a screen door, by the way. He runs out the house, and he runs probably a block, down the road, and he's running in the ditch. Well, all the cousins come out, and so it's like you just got a family of punching, just running after this guy. It's just all fist, and so they finally catch up to him, right? And he's ready to square off. Well, the nephew comes in with a Mike Tyson punch and just buckles this dude's knees. It was fantastic, and like I say that with just I don't know, it was just hilarious. Like in all seriousness, that was the best punch that I've seen like in a real fight ever. And it just right on the button. Like his knees immediately just lost all feeling. He hit the ground, but he didn't knock him out. And so he stands back up and tries to hit, gets popped again. And so what happens is one of the family members also brought the pogo stick, which I thought was funny. So they start hitting him with the pogo stick. And so, again, he evades them and gets out of the way and grabs a glass bottle, like a 20-ounce bottle, and throws it at me and my partner. And it hits the ground like probably 5 feet in front of us and shatters, and glass is going everywhere. And so, you know, we're like tucked, trying not to get hit by glass. And the family comes running over there. Everybody's out of breath. He's finally calmed down because the cocaine, I think, is getting out of his system. It's metabolized finally at this point. And we had pulled the stretcher out, and he sits on the stretcher. And I was like, hey, will you let me take your vital signs? He said, no, I'm just out of breath. I don't want to be seen. So at this point, all this that's happened, from the seizure to him fighting his family to them knocking him out almost, and the pogo stick and the bottle and all that stuff, police finally pulled up, right? And so they get out and they're like, what's going on? I was like, well, you just missed a grudge match. But everybody's calm now, except for the cousin who got hit with the pogo stick initially, and she was ready to go to prison for life. And so we're talking to him. He's calm. He's alert and oriented times 4.
No.
GCS 15, everything. And he's absolutely refusing to go to the hospital. So he did end up letting me check his vital signs. Fine. So we check his vital signs. Everything's perfect. I'm like, how's your heart rate not 200 right now? How's your blood pressure not high? All this. His sugar was fine. Like, everything's fine. He's just talking to us like it's a normal day. And literally the funniest and craziest call that I could think of that I've been on. I've been on some other ones, but that one probably topped all of them, I think. Because there was a lot that went into that call. And then once we finally like go to clear up, get the refusal or the TIP on him is what we call it, so a treat in place. And so we sit in the truck, and me and my partner just sat there for a second. It's like, what just happened?
Because like I think I've said before about like scenes that rapidly evolve.
Oh,
and like, you know, the instability of a scene and like scene safety, all that.
yeah.
I think that just topped all of it.
Yeah.
Because you want to talk about rapidly, like we literally went from like this dude sweeping his house to he's getting beat by a pogo
It was
stick.
0 to a million on that call. Like it was so funny because there's so many things that were wrapped up into it, and I tried to be as like systematic about explaining it. So I hope I gave a fairly clear picture. But yeah, that was one of the insane, like the craziest calls that I've been on, and we thought about that for probably over a week, trying to figure out like how to feel about it, because we could have just left, right? I mean, the scene is unsafe, so technically we could have backed out, but it's like there's no way I'm missing what's about to happen.
Exactly.
So I'm sitting there just like, we're at this point kind of sitting on the porch because it's like a show now. And then more family comes over, right? I forgot about this. So the cops are there. This is why I'm trying to talk them into going to the hospital. They're all trying to talk them into it. And the family's coming over, and they're like checking on us, like, "Are y'all okay?" I'm like, "I'm fine, but I didn't get hit with a pogo stick. You know, like I just got a bottle thrown at me." And they're like, "Well, who got hit with a pogo stick?" So we're just, we're trying to explain the whole situation. And the guy that was like their end all be all, like this guy, if he got called to the house, then the patient's going to the hospital because he runs the whole block.
Okay.
And so they call him over. It's like his uncle or something. They call him over. And he finally pulls up in this old, like, Impala. This, like, it's just decked out. It's such a sweet vehicle.
Oh, you
like,
already know.
They come rolling down the street, and, like, they're, like, bumping their music and all of that. Smoke's billowing out the windows and stuff. I was like, yeah, this is about to happen. This dude steps out. He's like Fetty Wap. He has one eye sewn up, and then the other one's like a crazy eye with a scar on it.
Oh, my God.
I'm like, okay. So he knows a thing or two about fighting, obviously. And he's kind of a jacked dude. Like he's an older guy, but he's in great shape. So it's not somebody that you're wanting to pick a fight with if you just have a choice. And he walks out and he's like, "Hey, you're going to the hospital." And the guy just stares at him dead in the face, says, "No, I'm not." And he's like, "Well, I guess he's not going."
Oh.
Like, I was like, okay,
I was
well,
expecting a lot more with that
yeah,
one,
just
not gonna lie.
yeah, literally, all of us were, including the police when we got there, and nothing came up. He's like, well, can you force him to go? I'm like, dude, all this introduction, like they've talked you up, talk about like you're the baddest on the block. You roll up in this like just crazy car. You've got the whole scene set for you, and it takes one simple no. He's like, yep, well, I can't force him. You know, he don't want to go. Okay, well,
You've let us all down.
yeah, literally. So it was kind of like a short, like if somebody filmed a short or a small movie. Yeah, it's basically what happened. You can't make that up.
No, and that's another thing to love about this job is that like it's calls like that like you're not gonna get that in the ER. You're not gonna get that in like your cute little 9 to 5 clinic. Like, dude, there's no other job like this one.
There's no pogo sticks or empty bottles in the ER. That's a guarantee.
Fetty Wap in the Impala.
Yeah.
So I'm like a kind of 180 of calls that are very memorable. What is a recent or past call that has challenged you?
Oh Lord. So this one, it didn't challenge me as far as medically or physically. I would say it was more morally and ethically that it really kind of put me to the test. And so I struggled really hard. Like this, I haven't had the call that's gonna break me yet. A lot of people will get that kind of early on sometimes. Some people may not get it for 10, 15 years, whatever. Thankfully, I haven't had that call yet. Like I've had a great environment that I've been able to grow in to teach me how to handle certain situations. And this specific call, unfortunately, I had not ever been in this situation, and I've never had a partner who has been in this situation that I can think of to be able to talk to about it. So we had gotten called to a home that was it should have been condemned. Like they didn't have running water in the house, they didn't have lights. There's holes all in the floor, and they covered them with rugs. They have books and boxes stacked up to the ceiling. They were just destitute. And so we walked in for cardiac arrest. And so I think it was for like a 85-year-old female. The call comes in as, patient's not breathing and patient doesn't have a pulse. And so they said that CPR had been started. So I'm like, great, because cardiac arrests are probably my least favorite calls. I think they're probably my least favorite because to an extent, you kind of can take the thinking out of it because it's very systematic, or it should be, for you to do the step-by-step process to, try and resuscitate. On top of that, it's not about how good of a medic we are, in my opinion, to resuscitate somebody. It's not our job to bring people back from the dead, but we do our best. We give them our best shot, to try and help jog them back up, to a normal rhythm and whatever else. And but if you just happen to get lucky enough with that one epi that you give and the perfect compressions that you're doing to actually get in some electrical activity to continue and to reactivate and be strong again, then that's fantastic. But unless everything happens almost perfect or it's just strictly a God thing, then you're not going to get them back. So I don't enjoy these calls very much. I actually find them to be extremely messy, unrewarding, and very boring personally. But my thoughts again could change on that later. But so for this call, they said CPR had been started by the family member. And so when we get there was actually no CPR that was going on. And fire department had shown up at the exact same time as us, and police department. So we all are kind of going in at the same time. And it's very, very close quarters. Like it's probably like an 8x10 room. They have a queen size bed in there that barely fit. There's like no room to walk around on any side. And due to the boxes and because how small the room was, this lady, it was so sad. Like she was very, very poor as far as like her build. She's very tiny. I found out that she had stage 4 dementia, and so this was an expected death. The son had told me, and so he was the only one there with her. He was the one who supposedly had done compressions, right? And so her mouth was dry. Like all of her orifices where it would be wet or have some mucus or something in it was completely dry. She wasn't stiff yet, but she was very cold when we got there. I mean, she'd definitely been dead for a while. She just had some lividity and stuff on her and stuff. So it was clear that this wasn't a recent death, but it was recently reported. So it was already kind of odd. And so when we walk in, I'm talking to the son, and the first thing that really keyed me in that this was going to be an odd call or odd exchange is when I was asking him questions about her history. And he said, stop asking me questions. Just give me a second. And I was like, well, okay, but I kind of need to know, right? And
Yeah, that's weird.
yeah, so he said, give me a second. I'm going through my database in my head, And I didn't say anything, but I'm thinking like, okay, so I'm thinking this guy's like mildly autistic, or he's got some sort of like
Literally.
personality, disorder or something like that.
Yeah.
And he goes and sits in the corner in the room and won't talk to any of us, the police, fire department, or nothing. And so it's not a lot of time that's passing. But everything needs to happen fairly quickly for this. So fire department had got in like just before us. Well, we got on scene together, but they got in the house just before us because we're getting the stretcher and everything. And so they had started compressions. And I told him, after he had told us that it was unexpected death, he said, me and the doctor have been going back and forth, and we knew she's probably going to die for some months now, and we just didn't know when. And so he said that she was trying to eat earlier that day, or he was trying to feed her, sorry, and she's at the point where she's forgotten how to swallow. So he said that she was having trouble eating, so he was massaging her throat to try and get the food to go down, and nothing was going down. So she could have been deceased by that point, from what we know, and that had been over an hour prior. And so he told us that he did compressions for 12 minutes by himself before he decided to call 911, and then he just stopped after he called 911. So again, very weird scene. And I said, well, listen, I said, we're here, obviously we're doing compressions and stuff. I haven't started IV or anything yet, and this is within like the first 2 minutes of getting on scene. I said, do you want us to resuscitate your mom? And I said, because I have no problem with that. I want to give her the best chance that she can get. But if you don't want us to do that, then we won't. I need you to tell me. And he said, well, you're just going to have to give me a second. So I have everybody looking at me, right, because I'm the one controlling the scene. So the police are looking at me, all wild-eyed, and the fire department is as well. And I told them, I said, guys, we have to continue to work her. So I'm getting everything out so I can start giving her to Epi. She's being bagged and all that, and they're doing compressions. And I said, sir, I really need an answer from you. And so he finally tells us, yeah, you can stop. You don't have to do it. Just stop. And it's like, okay, thank you. So that's within the first 5 minutes of the call. So everybody's cleaning up everything. They walk out, and it's just me and him in the house. And I said, listen, I just need a little bit of information about your mom. I know I'd asked you a few questions about her history. I said, but I need like her name, first and last name, date of birth, and a few other demographics if you can provide that to me. Then he just kind of puts his hand on his head and he sighs and he's like, yeah, I guess I can. I said, I know this is stressful. I said, if you can find her ID, I can just get it all for you. And, I said, I can let you kind of make your peace with it. And he's like, yeah, I'll go do that. So he goes and grabs the ID, brings it to me. And, he starts questioning my thought process, and he questions how long I've been a paramedic. And he questions why I'm asking him so many questions. He stated that I was asking him too many questions, and that just because I was a new medic, because I told him I'd been a medic for 3 years. He said, well, you're still new, so it's probably tough to multitask, right? I get that you don't really understand how to do these things. So he's being very demeaning to me, and there's nobody else in the house. It's just me and him. And so I'm very good about holding my tongue, but when I'm confident in my treatments, I'm confident in what I do. It's not that I know it all. I'm not a paragod or any of that. I've studied a lot for it. And that's what we're taught to do. Like, that's literally our job, to ask questions and to treat people. And so it just kind of caught me off guard. And like, he's grieving. So grief has 5 different stages, right? And at that point, he's not looking for an excuse. He's angry. And so I understood that. And so I did my best to be empathetic toward him and say, I understand this is tough for you. And I was like, I'm sorry that you feel that way. He's like, no. You're going to give me your name and your partner's name, and I need your supervisor's number.
Oh, and my God.
I said, okay, I can give that to you. I said, but do you mind if I ask why? And so that's when he starts telling me again, you just weren't prepared to do this, were you? You have no idea what you're doing. And you've asked, again, too many questions, and you've asked the same questions to me multiple times. And I was like, sir, no, I haven't. I said, you've had a lot of people ask you questions so far. It's me, the fire department, and police here. I said, I understand that you're stressed. And I said, you may feel like that I've asked you the same questions, but I haven't. I said, I've done what's been appropriate for your mom and for you and for me. And I said, but I'm going to give you a second. I need to go out to my truck and get my tablet. All I need is a signature from you just basically saying that we're not going to transport your mom, and you asked us to stop resuscitation. And he like cut me off before I could actually finish it. He said, well, I want to read the pamphlet that you have that's explaining what this signature's for. I was like, well, you can read it if you want. He said, well, I want a physical copy. I said, well, I can't provide that for you, right now, but we could send it to you later. No, I don't want it later. I want it right now. I said, well, then you'll have to take pictures, of the thing. And so again, like I'm being like belittled this whole time, and I can feel like my frustration just rising. My blood pressure's rising, and I finally told him, I was like, okay. I said, I don't care what you do. You can take a picture of anything on that tablet, anything I write down. That's perfectly fine. I said, but I need to go grab it real quick. And so I finally like cut the conversation off. Again, it's just me, him, and his mom in the room at that point. And so it's awkward, it's uncomfortable, and nobody wants to be in that situation. And I definitely wasn't prepared for that situation. So I go outside, and I told the fire department, I said, dude, I need one of you guys in here with me. Because police also had left by this point, by the way. I didn't find out until I went outside that the police had left.
Nice.
And it wasn't officer's fault that was there. It was just
Right.
miscommunication all the way around. I'm not blaming any of those guys. Like, they're extremely helpful to us in our area. The fire department is great. Our police officer is fantastic. It's just they had been cleared by their sergeant because I guess they had another call to go to.
Okay.
And so normally we ask each other, hey, is it okay if we clear, blah, blah, blah. And it was miscommunication. So the first responder that I saw or the first responder that I saw was fire department. I said, can one of you guys come in with me? The patient's getting a little bit hostile, or the patient's son's getting a little bit hostile. They said, yeah, that's kind of more the police department's job. And it's a jab, right? They're being smart on it.
Yeah.
Well, I wasn't in the mood for the sass. So I was like, you know what? Y'all can go ahead and leave too. Me and my partner will handle this. And so they're like, wait, no, I was like, don't worry about it. So, because I wasn't in the mood. So I go get my partner, and I said, man, I'm going to be honest with you. I don't know if it's going to happen, but I could probably fight this guy right now. I'm so mad. And I was like, I've never felt this about anybody. And obviously I wasn't going to actually fight him, but like, I'm just being human, And my partner was like, dude, what's wrong? Because he's never seen me like this. And this partner that I have, we've only been together about 5 months. He's 5 months into his EMT, period, like ever. He just got out of school. And so he's like, dude, what's going on? So I like gave him the rundown real quick. He's like, oh yeah, I'm definitely being there because I don't want anything to happen, and you'll be another witness. So we go back in there, and the coroner comes in behind us, because he finally showed up. Again, the belittling and the demeaning nature of this man just like is flowing out of the house. And he starts tearing into me again. After he talked to the coroner, I let the coroner talk first. He answered all his questions, gave him all the information that I'd already asked, right? But somebody else asked me for. So the coroner gets it, and then he sits in there in the room with us for a minute. And I said, listen, all I need is, your name and date of birth, just so I can write it down. Because I haven't asked him his name at this point. I've heard people say it, but, some people call them like by their middle name. I want to make sure I get the accurate information. So I said, I need your first name and your last name. And he looked at me like I was the dumbest person in the world. He said, sir, you've asked me that question 7 times now. I'm not going to give you the information because you've continued to ask me the same thing over and over. And like my mouth just dropped. And I look at my partner and I look at the coroner and I was like, is this real right now? Because I haven't. And then they're like, oh, like they literally throw their shoulders up. They're like, I don't know. And so, like I broke the 4th wall is what I felt like I did at that point. And so I was like, none of that has happened. Like I know you're stressed out. I know this is emotional, but you're being like belligerent and just resistant to anything that I'm asking. Like I don't understand, why it's so hard. But again, I'm trying my best to be as easy about this as possible. No, just give me the stupid tablet and I'll just take my picture. Okay. I said, I can do that. So I hand him the tablet, I get it to the area that we're at. He takes pictures of the entire document, but the document, I think total, if you were to like print it out, it's probably about 5 pages long, and you can only look at about 2 inches worth of paging, so it's about a paragraph at a time. And so it took us about an extra 10 minutes to let him scan through everything. And when he was taking his pictures, he would zoom in on his phone and he would say cheese right before he took the picture every time. So again, I felt bad for the guy. I knew that he was going through like a tough situation. He took care of his mom and said that with respect, I guess. The situation, adult services really should have been called at that point, but it's like she's already gone, So I'm not privy to those situations as far as what could be done. But it wasn't great living conditions for her or him, for that matter. But we finally get to the point where he signs his name, and I don't remember the question that I'd asked him, but he looked at my partner and then gave me that dumbfounded look again and starts hollering for us to get out of his house. And I was like, sir, I've literally been respectful to you this entire time. Like, I kind of cut him off with him trying to holler. And I was like, but you've been extremely disrespectful to us. And then he starts hollering at us in German. And so I looked at my partner. I was like, we need to go. I was like, this is not getting any better.
No.
We haven't harassed him at all at this point. We've been extremely cordial to him and everything. And he was just rude. Like, he was walking towards me as he's screaming at us in German. And so, he could have hit us or whatever. I don't think he was going to. It's just the fact that once I left that scene, I was so mad that I couldn't even type up my ticket. Like, I had to just shut the tablet. I couldn't hardly talk. And I told my partner, I was like, I've never felt like this. And I told him, I was like, honestly, you probably shouldn't even handle the situation the same way I did. I was like, you probably should leave sooner so you don't feel this way. Because we shouldn't feel like that towards the people that we're trying to take care of.
Right.
And granted, they shouldn't feel like that towards us, right?
Yeah, that's what I was about to say. The belittling was just unnecessary.
It was extremely inappropriate. But again, grief presents itself in different forms for everybody initially. It may not always be the same. So I don't hold anything against him. But I had to call multiple people who have mentored me and explain to them what happened and ask, did I do something wrong? Because I didn't understand why I got attacked like that. And the main thing is that I got attacked when nobody else witnessed it while we were in the house, verbally. And so that also made it difficult because it's like, man, how do you can be as nice as you want to him, but he's not receiving that. He doesn't get it. And so I had to really sit down and reassess. It bothered me for a couple weeks after that because I kept going once I leave work, I leave my work life at the door, and then I've got home life after that, right? So that's one way that, for one, I can keep my stress at work and then keep my home stress or home life at home or whatever. I just have to separate the two. I think it's healthy to do it that way, and so that's one thing I try to practice. And so every time I came back to work, I would just think about that, but I also couldn't leave that situation at work. I brought it home. And so I talked to my wife about it. I talked to my father-in-law, who's also my pastor at the church, to get his advice about it. I talked to, like I said, multiple different people who, for one, have lived through situations that I guess are similar, and then different medics. And they're like, no, man, I think you handled it fine, but they also told me that you don't have to take that. So I think, if anybody does go through a similar situation, they just know, you don't have to sit there and listen to that. We're not there to get belittled. We're not there to get talked down to or any of that. We're there to do a job and do it right. And so they told me, they're like, you literally don't have to sit through that. If they don't want to answer you, if they want to be rude or all that, then just leave, because it's not worth jeopardizing your job or anything else that could happen, and making a bigger situation. Don't make a mountain out of a molehill at that point. And I've never had an emotional challenge like that on a scene come close to what that call was. So that was difficult for me. So yeah, it definitely made me grow from that call. But I don't know if I do have another call, I'll kind of have an idea of how to react to it. But I definitely hope I don't get in another situation like that.
Well, I think it's commendable, even as you were talking about it, being able to say, well, yeah, he's going through grief. That never would have crossed my mind. And I just would have been I don't know who this man thinks he is, but I'm not the one, and today's not the day. Yeah. So, dude, I can't even imagine how frustrating that had to be, because just hearing that, especially, your competency being questioned on top of, you were literally ready to do all of the things for this man's mom, and he had the audacity. Whoa.
Yeah, and that's the other thing. I know we get a lot of negative light from different healthcare workers and stuff, but they don't understand. We're going into people's homes, into their private lives and private areas, and we are one of the only. We are working one of the only professions where you're allowed to do that, and you should be welcomed in there. And sometimes we are, and sometimes we're not. But they're still going to give us the call, and there's nobody else that's going to show up to do that besides police or fire department. But when we get on those medical calls or those trauma scenes, whatever, something like that, we're the ones who have to control it. And so if the police are running around crazy, which I haven't really seen. But I'm just saying, for instance, if they were, or a fire department's not sure what to do, then they look to the medics to be the ones that kind of help control the scene. And I'm not talking down to, the other first responders. They all have their place and they do a great job at it. At least, in my area, they do. They've been extremely helpful. But like I said, we are the ones who are looked at to be the calm in the storm, in my opinion, from what I've noticed and being on scenes and everywhere else. They're always asking the medics what to do. And it's partly, I guess, chain of command because of the situation that you're in. But, that's just one thing that's helped me is to try and remember that we have to stay calm. Like, we're the calm in the storm. We're the one that's steady. And everything else kind of revolves around us only in that moment. And that's helped me a lot, just to try and navigate through different calls that way.
Absolutely. Yeah, absolutely. So with all the things you've already said that are just on point, what's a piece of advice you give to someone either going into EMS or somebody already in EMS, someone thinking about taking the leap? What would you say to them?
Without being too much of a wise owl here, I think the first thing that I'd kind of given earlier, or advice I would say, is don't take yourself too serious. People get into this profession and they want to be the guy, they want to be the one that is getting to call the shots, unless they're doing it to be a stepping stone. And anyway, that's where you get that paragod complex or whatever, because they've been the doormat EMT where everybody's told them what to do, and they've had to clean the truck by themselves and take care of the stretcher, and they feel like they're just a slave, whatever. They get on scene and get told everything to do. Like, they don't get to call shots.
What does EMTB stand for?
Right.
Empty my trash.
Yeah, exactly. So it's like they finally get their paramedic, they studied, they've worked hard, and then it's like, now I get to put my thumb on somebody else, and there's no reason to be like that. Like, your coworker is what's going to really determine if you're going to have a great working experience or not, because you're with them for so many hours. Like, we work 24 hours each shift, and so you spend a lot of time with your coworker, and so it's important that you develop a good working relationship with them, and even sometimes relationships outside of work, because that is going to set the tone, like I said, for the entire shift, for one, and then just your relationship going forward. If you have a good relationship with them and you start becoming closer with them, then once you get on those calls and you start trying to tell them what to do, it's almost like you have this intuition to where you feel like you know what they're going to say at that point, because you've been hanging out so much. You just you have a rhythm with them, just like you would if you were to play in a band with somebody. After you play in the band with them for so long, you understand what their tendencies are, and you kind of have an idea of where they're going, and then you start making really great music that flows together, and you can kind of carry that over to EMS as well. Like, you can have a really good scene that's really bad for somebody else, but you start making it flow very well because you guys go in with the same intention in mind and same goal, and you start thinking along the same wavelength, and you go in smooth, but you're steady, and then it becomes faster because everything's smooth and you're not making mistakes. And so I think that part is very important. The other thing is you need to take care of yourself first. I think that's a really important thing. A lot of people want to pick up all these extra shifts because they want to make extra money, because EMS workers are so poor and they don't get paid very well, blah, blah, blah. I mean, it is true in certain areas.
It is, but I do want to add in, because I used to be that person. Somebody pointed out to me recently that it's not that you don't have the money, it's that you're not adjusting your lifestyle to
Exactly.
fit into this.
Right. You
That
have to
hit
live
me like a
within your
ton.
means.
Yeah, and it hit me like a ton of bricks. So
Yeah, I mean, and that's one thing. Like, people, go from being the EMT who made, I don't know, minimum wage at a lot of places. Not really with us, but a lot of places they don't get paid very much, or just above minimum wage, and then they double what they're going to make to be a paramedic, or sometimes more than that. And it's like, I'm rich now, but in reality, you're making $50,000 a year and you're not rich. The thing is if you can live within your means and budget appropriately, then you can be. And there's going to be people that disagree with that and whatever, but I mean, that's the truth. You have to learn how to budget. But aside from finances, taking care of yourself as far as taking time off or just not picking up that extra shift is extremely important. The burnout can happen so fast, and it doesn't mean that it's like someone who's been a medic for so long, they've been abused for so long. You know about the different healthcare workers and the people they take care of, and they don't get any gratitude, blah, blah, blah. It's not that. It's the lack of sleep. because sleep is so important to you to heal emotionally, physically, all of that. And with working 24 hours, you can get cat naps, and on the rare occasion, you might get lucky and you might get to sleep at night, whatever. But you're not getting a good sleep because you're so, or at least I'm not, because I'm so anxious we're going to get a call. And so once I get home, it's like, oh, like I can finally breathe, and I can just lay in my bed or on my couch or in the hammock or wherever I literally want to. And it doesn't matter how uncomfortable it is, I sleep better than I do at the station. Because I know I'm home. I know I don't have to worry about going to, pick grandma off of the floor at 3 o'clock in the morning because she was trying to go to the bathroom and she couldn't see and she slipped, or whatever. And I love doing those things. Like, I don't have any problem doing that. It's just, again, sleep is so important. De-stressing is so important. And so one of the major things we've dealt with as like I guess a nation in the past 2 years is depression and suicide rates. Part of that, of course, is due to like COVID and stuff and people being entrapped and all that, especially like at nursing homes and things. They can't see their families, and so they get extremely depressed and they're put on depression medication, whatever. So it's just not crowding your life. And so I'm a big proponent of or promoter of not picking up the shifts if you don't need it. If you absolutely need it, sure, do it every now and then. But you need to take time for yourself. Go camping, go ride a bike, exercise, play some music, go to church if you feel like that would help you. Or pray in your downtime or whatever you need to do. The main things that help me is going to be my faith and my family. We talked about the vacations earlier, so the vacations are extremely important. Usually we'll take a week. Last year we did 2 weeks. I've never gotten off for that long. I probably will never be able to do it again. But and like honestly, it was so nice. Once we got done with the 2 weeks, like I wanted to go back to work. I was like, man, I'm excited to go back. And like that's how you should feel. You shouldn't feel like, God, I have to go back to work tomorrow. I really don't want to go there. Like I truly enjoy it. And it's not just that I have the time off that's helped me. We have great management. And I truly mean that. I'm not like trying to blow smoke, to anybody. Like I really do like our management that we have now. They take care of us. If we have anything that we need, they'll help us out with it, whatever, at least to the best of their ability, or they tell us that anyway. But that's been extremely helpful to be able to have people for one that I can talk to, and then to trust that my management is going to have my back. And not every company can say that. It's just that's one thing that I'm blessed with. So I absolutely love that about our company. I could go on and on with advice, and it's not because I'm just like a potluck of advice over here. It's just things that people have poured into me that I would like to pass on. I love trying to teach. It doesn't mean I'm a great teacher, but I do enjoy passing on information that's been given to me. So obviously, I'm studying for the FPC that we've mentioned multiple times. That's another thing that I'm very inclined to do is encourage people to educate themselves. Nobody's going to make you learn new things. You may learn new things by happenstance because something happens, but to sit down and be intentional about learning is tough sometimes. And so, because like even now, like I want to learn this stuff, but then when it comes time to study, I'm like, dude, I can just do it tomorrow.
Right.
Like it's just let's just put it off one more day. And then when I actually sit down and I start taking my notes, and I'm very thorough with my notes and meticulous. And
I want to add, they are absolutely fantastic. I saw them and I was intimidated, so kudos.
they're different. Most people don't do that, and that's not to give myself any accolades. I'm specific about how I have these things because I know I remember things certain ways. So drawing things out, rewriting them multiple times, different colors, whatever, helps me to remember it better. And so I just, like I said, I encourage people to learn more because with our job changing constantly, we get different medications, medicines constantly improving and all that, whatever. You need to learn more because I look at it from the aspect of I may not be able to RSI somebody because we don't have protocols for it, right? But knowing the preparation that it takes to get to that, knowing the steps that we need to look for if we're meeting up with a flight crew or something like that, I can tell them, look, we've already assessed it here. This patient really does need to be RSI'd, or this patient really does need to be criked because their airway's failing at this point, whatever. Knowing that prior is going to help the patient all the way around. So it becomes a well-rounded assessment versus there's something that's missing, and you know that there's something missing, but you don't know what questions to ask or what things to look for. And so I'm trying to do my best to become as well-rounded as a medic as I can be. And for me to be such a young medic, there's so many things that I haven't even explored yet, and so that's why I enjoy it. There's so much more that I can climb towards and to learn about, and it feels like that I really don't know that much. Like studying on this feels like I'm in paramedic school, and your brain's scrambled, and it's like I'm learning so much information, but I can't pull any of that information on my brain right now. And then when I get on scene, not all of it, but it'll come to me like it's kind of at the top of my mind. And when I'm asking questions, it's like, oh, cool, here's a rabbit hole I can go down that I didn't do before, or, this, and this. And so that's been something that I've enjoyed a lot in the past probably 2 or 3 months as I've started studying, is that I'm just constantly learning, and I'm able to pour that into my partner. I'm not telling him things that are like trying to blow his mind and give him too much to think about. But if you want to be a good partner, I feel like you need to pour into your partner, especially if you're the leader of the crew, to help them understand why you do certain things. A lot of times our EMTs do want to become paramedics, and why not try and help them out and get them educated a little bit quicker before they get into paramedic school than just getting thrown to the wolves when they get in there. So I've had a lot of great partners, and even people that weren't my partners but still became my mentors because they just wanted to teach. And they've taught me so many invaluable things that I didn't get from school, and I never would have gotten from school, but it was through their experiences and what they've learned that they helped me to become better. So the only other thing, two other things that I want to add as far as advice, and I'm getting kind of long-winded, I know, but I try to tell people as far as when they do ride-alongs with me, slow down. There's no reason to get all hyped up and get anxious and be real fast on scene. A lot of it's just anxiety. You get nervous, your heart rate starts beating, you start having the shivers, and it's not even cold outside, and it's like, why am I shaking right now? It's because you're nervous.
Yeah.
And so it's like, just take some deep breaths, whatever. Take a few deep breaths, and if you need to, tell your partner, like, hey, this is my plan for the call. This is what I want to do. That's helped me. Like, we literally make a game plan before we get there, even though we know the call notes are not always accurate. So you may get there because somebody's in cardiac arrest, or they say the patient's unresponsive and not breathing, and you get there and they're literally talking and they were having an anxiety attack like 5 minutes before. Yeah, this stuff definitely happens. It happened to me last shift.
Oh,
So
God.
that was a little personal, but you just got to slow down. You start talking real fast. You start moving around, but you still haven't really made any sense, and people don't know what you even asked because you're talking so fast. And it creates a lot of tension. It creates more anxiety on the scene. Like I said, we're the ones who are supposed to be calm. So you just need to show up and be calm, because calmness is going to create that smoothness that you need, and that smoothness is going to transition into you technically being fast, because, like I said, you're minimizing your mistakes by just being steady-handed and steady in your thoughts. The last thing that I do want to add, and this literally is the last thing for advice, whether it's a paramedic, EMT, EMR, advanced, nurse, whoever's listening, it doesn't matter. The sirens in the background. Don't be scared to ask questions. That's been one of the biggest things that's helped me. Like, I love asking the doctors questions. I know they're way more intelligent than I am, which some probably are debatable. I'm not saying that they're more intelligent than me. I'm just saying in general, as far as
Facts.
paramedics go.
I'm not even going to disagree, man.
Yeah, we have a lot of intelligent paramedics in this field, and that are light years smarter than I am. And I'm sure they're smarter than a lot of the doctors. It's just they don't have the MD at the end of their name, whatever. But regardless, there's somebody that they want to pour into you a lot of times. And so I try to get feedback on calls when I bring them in. Like, hey, is there something else I could have done that would have helped this patient more, or that would have helped you guys more to ultimately help the patient more? And one of the coolest things is some of the feedback I've gotten from doctors that, like, I really look up to, and I know they're extremely intelligent, and I don't know if they actually like me or not, but they'll say, hey, man, like, you guys did a really good call. Like, that feels so good to know that you get that just pat on the back. I love getting that, and it has not happened often. It's been very few times, even though I felt like I rocked the call. You go in, and then just like, cool, you did what you were supposed to do. And we are supposed to do those things, but it does feel good, like, when you get recognized. And the other thing is, like, I didn't get into this profession to get recognition. A lot of people get into this career and they think they're going to get recognized and get all these accolades, and and trophies, awards, whatever, and thank yous from the people when they're walking on the street. And
EMS discounts.
loving them. Yeah, oh yeah, absolutely. You're going into Waffle House trying to get, like a half off discount. You're only paying $5 already. Like, yeah. Again, personal experience. I know people have done that. Anyways, it's just people set this this expectation that's too high, and it just comes off terrible. It gives a bad taste in your mouth for the medics that actually do that. And there's a lot of really good medics out there that don't feel that way. But like I said, the doctors have been so important, and even and a lot of the ER nurses too. I've asked them, and ICU nurses, like when I bring the vent patients in, I talk to them. I talk to respiratory therapists, and just see like, hey man, was there something else I could have done, or like, was this appropriate that I did this for the patient, or whatever. I'm just looking for feedback, and I really can't think of a time where I've had anybody be disrespectful. They've always been encouraging and giving me some really, really good advice to take home. They've even given me some like links, like, hey, why don't you go read this study or check this out when you go home after calls and stuff. And that's been a really, really cool experience to be able to go through that. So,
dude, I'm blown away, man. There's so many good things out of all of that, and I really, real quick, want to touch on the last part of like, if you just ask, if you just show that interest, you'll be reciprocated with whatever. If it's the doctor, the nurse, whoever
Absolutely.
it is, they'll give that back to you.
yeah.
And it's a matter of going back to another piece of advice you said, just asking the questions and giving the interest and not staying like. I also want to tie in something else you said was teaching your partners, whether it's like a quote unquote lower level or like.
Right.
Even like we're double stacked and I'm still learning something every single shift from something like from somebody that I've worked with. So definitely agree. Definitely want to touch on what you said about slowing down.
Yeah.
I don't know if you remember, we had worked together and I was doing a clinical during that time. Was that allowed? I don't know, but we did. But we had that one patient that was an overdose. And I don't know if you remember, like I went in guns blazing, and I went in and they were like, "Oh yeah, pinpoint pupils, blah blah blah." So I was like, "Okay," and I looked at you, I was like, "Give me the Narcan." And you looked at me, you're like, "Is there anything else you want to do?" And I looked, I was like, "No, she's not breathing. Give me the Narcan." And so I literally just Narcaned her, and she came back and everything turned out fine.
Right,
We dropped her off, she was good.
Right.
But after you were like, "Hey, you missed a lot of steps," and I remember thinking, I was like, "But I just saved this woman's life."
Exactly. Superhero.
Yeah, right. I am the hero today. You can take a back seat.
Yeah.
But then you were like, okay, but you could have started bagging her and then given the Narcan IN.
Sure.
And I was like, oh, yeah. And then you were like, we didn't get any vital signs.
Right.
So looking whole picture, this is what it could have been.
Yeah.
And I literally went from feeling like an actual hero to like, I was like, I'm a zero. So I also want to bring up, do you remember that call we had where that lady was so drunk? She ruined, I'm not going to say a whole lot, she ruined her family's vacation. And
yes.
I literally looked at her and I said, ma'am, because she kept yelling at her like 16-year-old daughter.
Oh, yeah.
And they were all upset. And so I looked at her and said, ma'am, hold the wall.
Yeah, literally. We're about to pat you down. Cavity search. Yeah. And I faintly remember the overdose too. And I mean, again, you can, at your own discretion, you can run the calls however you want. But I'm not perfect by no means with my assessments. I just try to. It's easier to see, for one, the things that people miss when you're not actually doing it. That's one reason why I like teaching and being a makeshift FTO, I guess you could say, because you get to stand back and you're there. Like if they were to do something wrong, whoever your ride along is or whatever, but you get to bounce ideas around, and while they're fresh in school, a lot of times too, and it jogs my memory for things that I've probably forgotten from school because I don't remember everything by no means. But it's also it's cool to see like different thought processes. I enjoyed that when I was in class, like when we were going over scenarios and everything. I hated scenarios. I'm terrible at scenarios. I feel like I draw a blank every time because I'm trying to visualize what's going on and then also think about what I'm supposed to do, versus in real life, you get to see what's going on. So it's like, I don't have to visualize it. It's literally happening. I can think about the treatment side of it and my assessment and everything else. And so, I hated doing that in class. But then, like, as I'm saying, I'm terrible at scenarios while I'm doing it and I'm the lead. When I step back and I'm the partner, I can see everything that they're doing, and I'm like, they should have done this first. Or that was cool that they did that first. I wouldn't have thought of that. Maybe I should do that first next time, blah, blah, blah. And I'm just seeing all that, like, I'm trying to correct myself in a sense um, when I see other people perform. And then I want to give them feedback just like I want feedback. And so I think that's cool when you do have somebody there as, like, I guess, a quote unquote safety net to try and help you out. And just maybe not tell you you're wrong, but point things out that you may not have thought of. So, yeah.
Very good. Um, but like I already know the answer. If you could change it all, would you still go down the path and go into EMS?
Yeah, I obviously would go back into it. Like I really do enjoy this, and I can't say that enough. Like again, you get a ton of stupid calls, a ton of calls that are not emergencies, uh, and that's the part that's romanticized. Like, oh, all you get is emergencies, and people are dying every time you get called at their house, and that's like 5% true. It's a lot of, like I said, lift assist, and you go there to where somebody's freaking out who's actually the caller that's freaking out, but the patient's not freaking out and they're just calm and nothing's going on, but it's been a misunderstanding or a medical alarm has been hit by accident. And you get over there and then you sit down and have a meal with the patient. I'm joking. I've never done that.
I was about to say, wait, I'm coming back.
Yeah, right. No, but it's like it's just a lot of silliness, and I wouldn't trade it. I've thought, would I be better off if I would have just maybe changed my trajectory at one point? Like if I would have not gone to college and gone straight into EMS, at this point I would be a medic for 10 years. And I don't think it would have helped me anymore. I don't think I would be a better medic because the classes that I got when I took my undergrad and got my bachelor's degree helped me significantly when I was in school. Like I've, and this sounds so bad, I felt so much smarter than my classmates. I didn't show them my grades. I didn't want to show them my grades because they were struggling. Part of it is because they weren't studying, or they were studying very poorly because they never learned how to study, or they're lazy, or whatever it may have been. And so I was almost like, I guess, ashamed in a sense to show them my grades because I was making A's when I was in class, and they're making 70s when that's the end point. Like they can't make any lower than that. And so I didn't want to embarrass them. If they asked me a question, I would try and answer it or whatever. Again, I'm not like some super genius. I knew how to study because it took me 4 years while I was in college to actually learn how to do that. And so I'd kind of rounded myself off by doing that, and it took a lot of really hard work to do it. And again, I'm not trying to give myself praises. It's just that helped me. And so once I took those AMPs over and over again, and I took those other biologies over and over again and try and get my grades better, and then the physics as well, and the biomechanics, and all of those classes helped me when we were in P school. And when they were talking about the physiology, I was like, oh, I remember that. I know that already. And these people are like minds blown trying to figure it out. So anyway, the preparation that I had, I think, benefited me more by having it than if I wouldn't. But of course, it set me back, right? It set me back a few years to where I could have been in this field for longer, but I don't know if I would have performed any better. And the other thing is I think it all set up just right. Like once I got in, I went through orientation with the guy who's actually our OM now, and I look up to him a ton. Steven's been fantastic. He's helped me with so many different things. He's one of the smartest medics that I know, and he's very open to help you out. Like if you have any questions at all, he doesn't make you feel stupid. He does want to pour into you, and he's like an encyclopedia. Like I ask him a question, and he just, it seems like he knows it. He's told me before, like, I'm not really sure, but he'll figure it out. And my other partner that I had for the longest time is Lane Abshire, he's a flight medic for a while. He's done all sorts of CCT stuff. He's done some search and rescue stuff. He's worked on the streets for a while. Lane's probably the smartest medic that I've met, in my opinion. But him and Steven were two like key medics that poured into me a lot and helped me tremendously. And they still do, honestly. Like I still call them about calls. I don't necessarily call them while I'm on calls, because I have done that before. Like when I first started, and I was real nervous and I didn't know what to do, and I just wanted like some insight. But I'll call them after calls sometimes. I'm like, hey man, like, what do you think about this? And we'll just kind of go back and forth. And I think that's healthy. It's a healthy relationship that I've had with my partners, and it's a healthy friendship that I've developed with them over the years. And so, no, I wouldn't change it, but I do want to change my end goal, I think, I don't know that I want to be a flight medic full time. I for sure do want to get my FPC. I do want to fly at some point, but I really enjoy working on the ground a lot. So I've gone back and forth with that a lot. I think I may do part-time flight if, if I'm up to the challenge, I actually pass the test, and I actually pass all the regulations they have to do to like actually fly with the company you want to be with or whatever. So if I can get through all those things, then yes, I will fly. But regardless, it's just continuing to expand my knowledge, and that's my main goal.
Very good. And I do agree 100% that it's not that you were set back because you went to college first or whatever like that. I really think that helped you 100% because I was one of those students that went from teaching high school English and speech to EMT, zero to hero route, and like being in the AMP portion, literally just like I had to get this specific app and like literally zoom in and look at every specific thing because I was so behind. And I was one of the people that I wish I would have gone to college for something that actually mattered.
Right.
Not that teaching English doesn't, it does. But something that mattered to me now. So if I could do it over, I would envy the path that you took.
Yeah, for sure. And well, I don't know about envy, but it was helpful. And then I don't think that either of us really took the zero to hero route. Not like a true zero to hero, because I worked with a person recently who literally got their EMT.
I know who you're talking about.
Well, they got their EMT and did not work as an EMT, and then went straight to paramedic school. Still did not work as an EMT through paramedic school, and then they waited a few months, and now they decide to get on the truck. Fantastic person, extremely smart person, but they have zero truck experience, so it was not as difficult as I thought it would be, but they literally went zero to hero. Like, they didn't have any straight experience. They only had the clinical experience that was given to them in school, and that was it. And I really hated that for that person, because it's like they are set back and they're not prepared like they should be. And so then it's up to the the FTOs and whoever else and their coworkers to try and help them. And that's what we're going to do, because we're all here for the same goal.
Right.
We don't want anybody else to drown or get thrown to the wolves or whatever, even though that does happen sometimes. But we're all here to help each other out and get to the same goal, which is treating patients appropriately. And so, I don't know. Once I got out of EMT school, I knew I was going straight to work, but I also knew I was going to have to study while I was doing that. So it's like, yes, zero to hero in a sense, whatever, because there's a dogma where you have to work for a few years as an EMT before you can become a paramedic, or you won't be a good paramedic, or blah, 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 whatever.
Which is not true.
No, not at all. But I don't think it's for everybody to do that. I do think it takes a certain amount of confidence in yourself. Mm-hmm. And you need to be able to affirm yourself in certain situations a lot of times, which self-affirmation is not something that everybody possesses. So that is kind of a tough aspect that you need to, or quality that you need to have. And then just knowing how to study. And like I said, those things I think are the most important. If you feel like you have those and you have a good support base, then I think you'll be fine. But yeah, I don't feel like a super zero to hero, but it is along those lines, I guess. I just want to throw that in there. It's just a side note.
Love it. Well, dude, if you anything to add or anything like that, I mean, I'm blown away. I'm speechless.
Yeah, like I said, I feel like that I've been kind of long-winded with a lot of my responses, but I did want to ask you, but I have enjoyed the conversation.
No, same, man. I appreciate you. Appreciate you sitting down with me, going through this. Appreciate the coffee shop that has provided the ambiance, if you will. So I hope you enjoy the ASMR in the background of the coffee shop. But Jacob, appreciate you. Appreciate all that you're doing. I'm really proud of you. Can't wait to see what you do in the future, man.
Thank you. I appreciate it. Thank you for asking me. It is much appreciated.
So with that.
So guys, if you have any questions, comments, concerns, future topic ideas, please email me at 22atthelips.podcast@gmail.com. Again, that's 22atthelips.podcast@gmail.com. Thanks. Never stop learning, and be safe out there, friends.
as far as like your new job, and you can be as short with your spiel about this as you want, but comparing it to the old company, and also I'm throwing this out there, I'm not asking you to like trash either company.
No, I'm
just
not.
yeah, right. I'm just wanting your opinion. Like, do you enjoy your new job more than you enjoyed the old one, or are the people are the people different? Do you roadside post more? How's the relationship with like the fire departments, the police, stuff like that? Just because I've never worked out of state before as far as EMS, so I don't know how that dynamic is, in a different state.
Yeah, no, I appreciate that.
Yeah.
I definitely feel like I was lucky not only to have worked at a different agency before going to the one that I'm at now, but the agency that we were at, and this is not brown nosing, this is 100%. I feel like we do roadside post a lot more, kind of almost level to what our competing agency down here in Louisiana is.
Okay, yeah. He who cannot be named, or
right.
she, whatever you want to say. Gender neutral company.
They, them. But it's also because of like the station that I'm at. So certain trucks are like the priority trucks we have versus like the station I'm at is kind of, because we have the 2 trucks at the one station.
Yeah.
We rotate.
Okay.
But we're up all night as well for posting. So
Sure.
if one priority truck moves, then we go post over there because we have the 2 trucks.
Yeah.
Which is only fair. A lot of, and that's kind of like a newer thing, and a lot of people were up in arms about it. Like, oh, well, that's not fair because we're up all day. We also have 2 trucks that go out.
Right.
So.
And so it's only 2 per county that y'all have? Like.
We have 5 trucks total.
Okay.
Like ALS 911 driven trucks, but we have like 2 minimum at our headquarters, which are like the IFT, quote unquote, which are stacked with an advance and an EMT.
Right.
Whereas all the 911 trucks are double stacked paramedics.
Sure. So and are some of the trucks daylight trucks, and then you have some 24, or is everybody a 24-hour truck?
We have mostly 24s. There is one station that is like a daylight, and then you have your night shift, whatever, they interswap, but they're 4 days straight in a row.
Sure.
So, like, if I live, like, 2 minutes from the station, that'd be sick.
Right,
but
right.
I don't. I live 40-something minutes from the station,
Sure.
so that is not sick.
Yeah, I got you. Yeah. Yeah. So, I have 2 more questions, because the interview is mine now. So, as far as medications, I know that y'all's medications got to be different than ours. Are there any medications that you miss having an option
Ketamine.
to use? Okay.
Ketamine. No, I'm just kidding. I'm not that kind of medic. Kind of, sort of. I do
She's
miss
a
ketamine. Not that I want to send anybody down the K-hole, because I've been in a terrible experience. Do not recommend. Just in a clinical setting.
Without
not
a paralytic, though, right?
Terrifying stuff. So I've actually only snowed one person. They needed it, but it was, oh God, the whole time I literally was like, as they're like throwing fists, I'm like, think happy thoughts, think happy thoughts.
Oh, yeah, exactly.
Dude, I miss Toradol. I miss Toradol, Solumedrol, and ipratropium bromide, which Solumedrol and ipratropium bromide I have brought to our medical director, and I'm not saying I'm copying and pasting and sending this to him, but, I also brought up cardizem, which we didn't even carry, but we also have a very elderly population.
Yeah.
So, but I did find out from our medical director, cardizem and I don't have statistics to prove this, but if my medical director said it, who is a very smart, intelligent man, I believe it.
Yeah, exactly. Anecdotal evidence.
Right.
What's it going to be called? ABM? Anecdotal-based evidence. Or medicine. Yeah. Anecdotal-based medicine. That's what it is, yeah.
But because I asked him, I was like, dude, why don't y'all push cardizem? Like, they cardiovert almost everything, it feels like.
Oh, cool. No medicine.
Right. That's what, like, we brought in an AFib, and they were like, all right, here's some ketamine. We're going to go ahead and sedate you, and we're going to cardiovert. And I was like, literally, my mouth is open. I'm like, oh my God, wait. But I found out from him that cardizem decreases the effectiveness of cardioversion by 60%. So then when he said that, I was like, holy smokes. He's like, yeah, so if you get cardizem, it'll fix the AFib if that's what the problem is.
Sure.
But if not, when we try to cardiovert, it's not going to be as effective.
Yeah.
So I was like, Okay, that's good to know.
The only thing is, though, I feel like if, and I'm obviously not a medical director, but if they're already taking cortisone and you have it, it wouldn't be a bad idea to go ahead and just give it to them because they could have just missed that day, honestly, and they've had a stressful day and whatever. And
Which I did bring that up because I was like, okay, but if the patient has high blood pressure, you're not going to give them labetalol because it might do something else. He's like, well, that's not it. I was like, I'm not saying I got into it with my medical director, but
she did not get into it.
Kind of, yeah. It was a very cordial, very polite, and very enlightening experience. But
he's writing like your letter of termination as well as you're having the conversation.
I completely understand, Doctor. Insert name here. No, but to answer the question in a very roundabout way, I really do. I just miss Toradol because it cuts out the necessity of narcotics significantly, and very much in Utah, they're very into not giving like pain meds in the ER or anything like that, which is the wildest thing because it's exactly what we do.
Yeah.
And I don't know, like if I'm in pain and I go to the ER for back pain, like I would hope to God I would get more than just a little Tylenol if I'm really in that much pain.
Yeah, just go to urgent care.
But like I don't want to add to the opioid epidemic that we have, but at the same time, like, dude, if people are in pain, like that's my job to treat it, let alone go to the ER and they don't. So I think Toradol cuts out a lot of that middleman, and it's just, dude, like you said, especially for the stomach pain, I never thought about that. It just really takes out a lot of that middleman of pain management.
Yeah. So last question, and you may have kind of answered it already. Your favorite medication and why?
I know everyone's going to think I want to say Epi 1-to-1, and a part of me does. Honestly, albuterol.
Why?
Because I love the respiratory system, and it really is such a magic drug of anything like wheezing, except for pneumonia, anything like that.
Sure.
It really does just, you can watch, kind of like you said with the Benadryl, you watch that patient just turn around.
Right.
And it is it is a BLS drug that could literally create the turnaround effect of that patient.
Sure.
If you just start small with that instead of going straight for whatever, unless it's indicated.
I'm going to save you the 5 minutes of delay where I tried to figure out the other use of albuterol, and it is for hyperkalemic patients. And I do want to point out that with Jacob, I said something about sine wave, so I was on the right track. It just, I don't know, it didn't come to the forefront of my mind for whatever reason. But that's also why I love albuterol.
Anyways, just because like you give it for your allergic reactions, and for me personally, unless it's one of the big ones, that also is one of the things that turns it around because of the beta agonist effects and the all the other alpha agonists, all the things it does.
Sigma agonist, all of it.
Kumalat agonist.
Yeah, right.
But I don't know. I just more so than narcotics, more so than all the other fancy drugs, more so than Solumedrol, more so than whatever. I really feel like albuterol is just very underrated.
Sure.
And then you pair it with ipratropium bromide.
Oh, yeah.
Holy
The
cow,
name alone.
boys.
Yeah. You're right.
So,
Cool.
that's all I got.
I just figured I'd hit you with a heavy hitter at the end. So I
Got
think
me
that's
so
the
good.
only questions that I have. But I have enjoyed the conversation.
No, same, man. I appreciate you. Appreciate you sitting down with me, going through this. Appreciate the coffee shop that has provided the ambiance, if you will. So I hope you enjoy the ASMR in the background of the coffee shop. But Jacob, appreciate you. Appreciate all that you're doing. I'm really proud of you. Can't wait to see what you do in the future, man.
Thank you. I appreciate it. Thank you for asking me. It is much appreciated.
So with that.
So guys, if you have any questions, comments, concerns, future topic ideas, please email me at 22atthelips.podcast@gmail.com. Again, that's 22@thelipspodcast@gmail.com. Thanks. Never stop learning, and be safe out there, friends.